My name is Delaney. I'm going to be performing a cranial nerve assessment on my patient Brooks. First things first, I'm going to do hand hygiene. And then we'll go over the first cranial nerve, which is olfactory. So I'll have my patient occlude one nostril and close his eyes and tell me what the smell is.
Mint.
Perfect. And then the other nostril, and close your eyes.
Cinnamon.
Perfect. Going on to cranial nerve 2, which is optic. I'm going to have my patient read a few sentences from a book at about 14 inches away. I'll have you close one eye. Just read 2 sentences.
The perfect surrender and humiliation were undergone by Christ, perfect because he was God, and surrendered and humiliation because he was man.
Perfect, and then the other eye.
Now the Christian belief is that if we somehow share the humility and suffering of Christ, we shall also share in his conquest of death and find a new. After we have died and in it become perfect and perfectly happy creatures.
Okay, and then both eyes open.
This means something much more than our step in evolution. The step to something beyond man will happen.
All right, so words are clear and able to read, so cranial nerve 2 is intact. Going on to cranial nerves 3, 4, and 5, which is ocular motor, trochlear, and abducens. So this looks at the eyes. I'll first look at his eyes. I see that they are round and symmetrical, about 3 centimeters, or 3 millimeters. And then I'll have you keep looking forward, and I'll shine a light in your eyes. Perfect, and they are constricting with the light, and they are dilating with further away. So cranial nerve 3 is intact. And then going on to 4, cranial nerve 3 was looking at the pupils, and cranial nerve 4 is accommodation. So I'll have you look at the window, and then I'll have you look at my finger. Perfect, and they are constricting with that closer up object. And then with the last one, I'll have you follow my finger. Keep your head still. The eyes are coordinated and not jumping, so cranial nerve 6 is intact. Going on to 5 and 7, it is trigeminal and facial. So I will have my patient close his eyes, and you can tell me when you feel this on your face.
Yep. 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 Yep.
And patient is able to feel all those, so cranial nerve 5 is intact. Going on to cranial nerve 7, which is facial, so I will have you smile and frown, and then raise your eyebrows, and then close your eyes really tight. Perfect, and the face is symmetrical with those movements. Going on to cranial nerve 8, which is acoustic vestibular. So I'll have you close your eyes and cover one ear. You don't have to close your eyes for this one. And then I'll say a couple words behind you, and then, or whisper them, and then just tell me what you hear.
Dog. Leash.
Perfect. And then cover your other ear. We'll do the same thing over here.
House. Apartment.
Perfect. So cranial nerve 7 is intact, or 8. And then going on to 9, 10, and 12, which is glossopharyngeal, vagus, and hypoglossal. So with this one, I'll have you stick your tongue out for me and say ah. Say one more time. Perfect. And soft palate and uvula are raising symmetrical. And And then for the next one, I will have you swallow. Perfect. Patient is able to swallow. And then for the last one, I'll have you stick your tongue out and say, you can put it back in your mouth, and say light, tight, dynamite.
Light, tight, dynamite.
Perfect. And the tongue is protruding the midline, and words are clear and concise. And then the last one is cranial nerve 11, which is accessory. So I will have you raise your shoulders against my force. Perfect. And it's equal. And then to the right with your face. Perfect. And then to the left. Perfect. Both sides are equal and with good strength against force. So with this assessment, there are no concerns and all cranial nerves are intact.